Good afternoon, everyone.
Good afternoon to you. We're in the process of doing the admission for everybody, so we're just going to hold up for a minute or two to allow everybody to join us, and then we'll get rolling.
Now I'm on.
So I will get started while we still continue to admit people. My name is Patrick Hood, Lieutenant with the Maine State Police. But in this role, more importantly, I'm a co-chair for the Maine Council for Elder Abuse Prevention. And I share that role with Jill Randall, who most of you saw on Tuesday for day one. I was tied up on that. We had an event locally for the Law Enforcement Memorial here in Maine. And I've yet to figure out how to duplicate myself with all that we have going on. But a sincere welcome to all of you. Some of you, it's welcome back from Tuesday. And some of you, like me, it's welcome since maybe the last time you were here, which was a year ago, to our 9th annual summit. We have put together a program today that really started about a year ago when probably most of you attended and sent us feedback as to what you liked, what you thought we should look at. And we've come up with day 2 of the program that's scheduled until 4 o'clock today. And just a couple of things before we do get started. For those of you who are a lawyer, this course in totality has been accepted for 4.5 continuing legal education credits. And if that's applicable to you and that's something that is a benefit, please contact Jill Randall for that process to start. I think Jill will drop her information into the chat so you can take care of that. It looks like it just popped up now. The other part I wanted to mention is that we are supported and have been, fortunately, for the last several summits by the Maine Credit Union League as far as what's happening behind the scenes. It's something that we're very, very fortunate as a small group to have, but all of this comes together, the tech wizardry, because of the expertise that they have. And I just want to extend a thank you to Rob and Ellen who have helped us with that. We do are going to be asking for questions in the chat. There's a lot of us here now. It looks like we're up to 146. We're going to utilize that because we do have members of our team that will monitor that. And hopefully, as time allows, be able to address all those questions. But depending on the level of questions we have, it may require us a follow-up through email to answer specific questions. So please know that if your question is not answered and you would like to receive them, we're happy to connect on email as well. What's important to me to know is how many of you here, and I can only see 25 of you, but if you could raise your hand if this is the first summit you've attended, because I want to know who the newbies are so we can, look, that popping right up. There's a few. I can tell you in our world, we have had a lot of change, a lot of retirements, a lot of new folks coming in and saying, I'm willing to help out to hold that line, especially as we talk about the topic of elder abuse. We've always said it's a community problem with a community solution, and that remains true for all of you that have taken the time to join us today. And our hope is that you will leave with some type of either contact, skill, educational piece that will make you better at your jobs. That's certainly what I'm looking for here today, either through questioning or through listening to what all of you have to offer. So again, my sincere thank you for joining us for the afternoon and being part of we take a lot of pride in being able to network, connect in this model with now 150 of you. So as we get started today, we have a panel discussion that is going to consist of Maine and national speakers. something again in this forum that we think here in Maine, we do a lot of things well, but a lot of the stuff that we pick up is happening nationwide. And we're proud to say that, hey, in Maine, that's something that we're doing, or something that started in Maine is being pushed across the nation, best practices. And that's something that we're going to hear from today as we get started. One reminder before we do just that, the notice that this is going to be recorded did come up before it even got a chance to mention it. We will post this as well as day one on our webpage. And that webpage, we're actually going to access that at the very end as we talk about some requests to help us with the World Elder Abuse Awareness Day campaign that will be coming. So thank you all for sharing your hands, your virtual hands, on being here for the first time. I appreciate that. We look forward to having a long relationship with all of you as it relates to seniors in our communities and the many, many roles, community roles that we all fill in trying to protect or educate or both the seniors in our day-to-day lives. So as we get started, I will introduce our first block of instruction. As you can see, or it was attached, it's titled An Update on RISE, and that's Elder Abuse Institute of Maine is part of that program. And we have today, we have David Burns, who is from the University of Toronto, joining us as part of that. We have MT Connolly. She's from the takes part in the MacArthur Foundation. She is a returning face, and it's good to see her today. Patricia Kemble, she's the executive director of the Elder Abuse Institute of Maine, is here. And finally, Jeff Rogers, director of the Learning and Development Project at the Silberman School of Social Work at Hunter College, is here as well. So that panel is going to be supported as well by Erin Salvo, who was here on Tuesday. She's the associate director of Adult Protective Services. And if I have my notes correct, Mr. Burns is going to be moderating this panel. And sir, I'll hand that over to you to go ahead with your presentation.
Thank you so much, Lieutenant Hood. And let me just start off by really expressing a warm thank you to yourself as well as Jill for inviting us back. And as you were saying in your introduction there, this really is what we're going to be talking about today is really is something that started here in Maine, and has picked up traction across the rest of the country and as well as outside of the country. But it's, coming here and presenting to this summit is holds a very, I would say, like, warm place in all of our hearts, because it's really, I see a lot of familiar faces here and on the participant list who we've worked with. And so we really appreciate being invited to talk and seeing many of you here today. So with that, I will share my screen and get started. So thanks for these introductions, Lieutenant Hood. So here is our team. I will also just mention Dr. Stuart Lewis, who unfortunately couldn't be here today, but is also a part of the team as well. I'm actually going to pass it over to MT to start things off.
Great. Thanks so much, David. And we're continually impressed by this summit, which is also evidence of the dedication of Maine to these issues. Just a really quick overview. We're grateful that you invited us back, and we don't want to repeat what we did last year, but we want to lay a quick foundation for what RISE is for those of you who are new to the program. And then we'll talk about some new developments in the research, in practice, in systems that we've worked with, and in some of the issues that we're trying to take on. We're really excited to have perspectives from the field, to have some of the team talk about actual cases that they've handled and how that works, and then to do the research and engagement update. So I'll pass it back to you, David. Thanks very much.
Great, thanks, MT. So just very brief, we're going to go through this fairly quickly, but basically why did we kind of do what we did? And so coming out of prior research and sort of extensive consultations with stakeholders in the field in Maine, we realized that there may be sort of a gap in the service system as it relates to kind of the elder abuse and self-neglect response system. And so this data I'm going to show you here is actually national data. It's not specific to Maine. And I do recognize that APS programs across the country are quite different. But in general, across the country, APS takes in about 1.3 million, or intakes about 1.3 million cases each year. Of those, about 770,000 go out for investigation. And then of those, approximately 260,000 are substantiated for some form of abuse, neglect, exploitation, or self-neglect. On average, again, this is across the country, not specific to Maine, investigations last about 55 days. The total kind of length case open time is about 67 days. And so, you know, again, recognizing that there is variation across programs, generally speaking, you know, APS programs will have the sort of opportunity to engage in brief interventions, make external referrals, and certainly meet immediate safety needs, and you know, kind of play that critically important role. What we sort of learned through our consultations is that there may be sort of a piece missing, sort of a complementary piece missing to this critical role, which is sort of a longer term intervention phase to work with cases. And so that's where RISE kind of comes in, and more importantly, the kind of the partnership between APS and RISE to kind of fill this puzzle, so to speak, sort of complete the entire kind of span of the intervention cycle. Again, very briefly, you know, RISE was developed, because we covered this last year, but developed in part through theory. It takes an ecological systems approach, which basically recognizes that cases are complex, and that ideally you would be working with, you know, victims, perpetrators, their relationship, their family system, and sort of the social support systems that surround them. It takes a very client-centered approach in that, recognizing that, again, each case is very different and is often driven by the wishes and the kind of self-determination of older adults themselves. And then a relational perspective, recognizing that often, you know, older adults are often reluctant, not eager to become involved in these types of programs. And Jeff's going to talk a little bit more about that later. So RISE, what are the core kind of modalities that we use in RISE? So I'll start out with motivational interviewing, recognizing that older adults are often reluctant to engage in services. Motivational interviewing is something that helps kind of open people up to the possibility of change. We use restorative justice or approaches to when older adults want to involve the perpetrator in this work, to hold the perpetrator accountable while also repairing harm in their relationship. We use something called teaming to strengthen systems of social support surrounding the victim and the perpetrator, both informal and formal systems of social support. And we use supported decision-making in cases that involve older adults who lack capacity. And then principles of engagement and goal setting sort of flow throughout the entire process. RISE also stands for these sort of different levels of ecological influence, again, working with people as individuals, with them as a relationship, and then larger social and environmental levels of influence that may have exist in the case. And then this is sort of another kind of way of presenting the model. Again, I think we presented this last year, so I'm moving fairly quickly here, but again, just sort of to represent the different modalities that we work with and the different kind of levels of ecological influence. This kind of sort of a conceptual description of the RISE model can be found through this article here on the left, which is actually open access and can be accessed by anyone if you search it on Google Scholar. And I'm going to pass it over to Erin at this point.
Thanks, David. So just to touch on the timeline of how this played out initially in Maine, that service gap idea and the intervention phase and the modalities were all part of a hypothesis back in 2018. And that's when Federal Health and Human Services Administration for Community Living had opened up a grant opportunity, a 3-year grant that this team applied for, to say, we have an idea, we want to develop it and implement it in Maine. But we were awarded that grant and began kind of building up what this structure could look like. How do we put it into practice while collecting appropriate data in a way that would really work for both APS and also elder advocates within the program, and most importantly, would work for clients. We launched that program after months of coordination to stand that up in July of 2019 as a 2-county pilot. And we initially categorized all of Maine's counties into either urban or rural to the extent that's possible, randomly selected 1 urban and 1 rural, and those 2 counties ended up being Cumberland and Aroostook. So we were able to carry out the program in those 2 counties for that grant project. And from the start, the idea was to really try to be thinking ahead. If this does go well, if we see that there's a positive impact here, how do we continue it beyond initially a 3-year grant? As you note here, 2020 fell right in the middle of this. So it was also a little bit complicated by COVID, which prolonged the grant experience initially, but we were able to kind of continue to be flexible, adjust along the way. And ultimately, as that grant timeframe was wrapping up, the federal government announced a few additional grant opportunities to support states, and specifically to support state adult protective services programs, which was very exciting because historically adult protective services has been an exclusively state-funded program. So having that attention on issues that affect older adults and adults with disabilities at the federal level was new and a great opportunity for us to continue this pilot, not only continue it, but also expand it based on the positive experience we'd had thus far beginning in 2021. So after the COVID response and relief funds were initiated, thereafter, we also received a grant through the American Rescue Plan. And that's what is supporting this work today. That will support this work through 2024, and we're continuing to explore options to continue it into the future beyond that.
Thank you so much, Erin. And I'm going to pass it over to Patty at this point.
Thank you, David. And yeah, thanks to the committee as well. I want to echo my appreciation for inviting us back to share the results of this work. It's been an amazing partnership and an amazing project. And we're really pleased with the results and glad to be able to share them. So the RISE project, I want to note that what the model that we use is RISE. The program organizationally that we call our work, we house that work in the program called Elder Service Connections. So some of you may know of the Elder Service Connections program. The RISE model is what we use in that program. It's housed in our organization, which is the Elder Abuse Institute of Maine, and we are a statewide nonprofit organization. We get referrals directly from APS caseworkers. Those referrals can come during or following the APS investigation phase. And the process for our engagement essentially is that the caseworker will offer the program to a client. If the client is in agreement and wants to participate, they fill out a referral form, which comes to our program supervisor, who then passes that case along to one of our advocates. The advocates begin their work by engaging directly with APS to find out more information. And what we have found in our work is that the ideal sort of handoff is what we call a warm handoff, where the APS caseworker and our advocate work together to connect the advocate to the client. We call that a warm handoff. Our program receives referrals from any type of maltreatment for clients that are APS clients over the age of 60. So we do work with self-neglect as well as abuse and exploitation. As noted, our advocates are trained in and implement the core components of the RISE intervention model. David noted them as motivational interviewing, restorative justice, teaming, and supported decision-making. And as David also noticed, we spend a lot of time and effort on engagement and goal setting. RISE was designed to complement existing APS services. So as I noted earlier, we can work simultaneously with a caseworker. Oftentimes our cases are kept open while we're working with them, or sequentially. So the case could be closed and then passed off to our advocates, depending on the client needs and referral. So that's those are sort of the program, the operational pieces of the program. Next slide, David. Thank you. So this is a high-level overview of the first 4 years. As Aaron noted, we launched July 8th of 2019. That day will forever be etched in my memory. And since then have been referred and worked with approximately 450 cases across the state. As Aaron noted, we originally launched in Aroostook County and Cumberland County, and we are now statewide. The average client age is 75 years. 60%, approximately 60% of our clients are women, 40% identify as male. We have a team of 11 across the state, which is really, really exciting. We were able to hire a cohort of advocates this winter, two of whom will be presenting cases today. So we have a team of 11, which includes a supervisor, team leaders, and advocates. As Aaron noted, when we first launched this, we were trying to understand the differences in implementing this program in a more rural part of the state and in a more urban part. And what we found is while communities are, of course, wildly different in our state, the data and the program itself and the impact worked in both a more rural setting and a more urban setting. And as I noted earlier, we call this program within our organization Elder Service Connections. This is a slide to sort of demonstrate visually. This was prepared by Polly Madsen-Cox, who is our program supervisor. It is one advocate working with one case. And this is sort of a visual example of the importance of building social support for our clients and the advocacy, networking, and service delivery navigation that happens on behalf of our clients. This is a very client-centered program. Our client is at the center, but what often happens in our cases is our clients lack social support or connection to services. And so one of the hallmarks of our program is intensive advocacy and service connection. And this is a visual representation of one case and one advocate building social support. Pass it back to you, David.
Thank you, Patty. It's amazing work. Thank you. So, you know, I think that like it's just been a really sort of unique opportunity and sort of experience in Maine to sort of make an impact through the collaboration between state and community-based agencies, and certainly, you know, as well as, you know, sort of partnerships with research as well, and you know, and I think that you know, while we could certainly have a different probably session on this issue on its own, I think it's just been a wonderful learning experience for all of us, and certainly relies on certain values of trust and sort of to kind of move that work along in such a collaborative manner. So what I guess is a sort of a new component to share this year is some of the evaluation findings that we've generated since last year on RISE, as well as the partnership between RISE and APS. And so there's a few different kind of categories here related to feasibility, the acceptability of the program, and then some improvements on various outcomes. So I'm going to start with feasibility, which really, you know, in this specific case, comes down to the ideas of engagement and retention. We understand that those are arguably, you know, some of the more difficult kind of challenges to overcome working with cases of elder abuse and self-neglect is actually kind of getting people to accept services and to stay in services. So far with Rise, only 6% of clients who are referred to Rise end up declining services, which is a fairly impressive acceptance rate. And then among those who do accept services, only 4.5 drop out prematurely or before their sort of, casework and treatment plan and so forth has been completed. So again, I would say promising findings on that front. And I'm actually going to pass it over to Jeff at this point to talk about the kind of related to that finding, the importance of engagement in the RISE process.
Thanks, David. I was really very happy to hear that you guys actually wanted back. It was a little bit of wanted us back, and I did say me, but I didn't really mean me. I meant us, and I was like a little Sally Field, like, oh wow, this is great. I think one of the reasons why I had that reaction is that I think that RISE is one of these really amazing projects. It's actually the most amazing project that I've been involved with in terms of centering the importance of engagement. And I started this work quite a long time ago as a caseworker in New York City Adult Protective Services. And when I moved over to Hunter, I left Adult Protective Services after 16 years, and I was I guess I was sort of always curious about how can you be more intentional about making sure that you center the work around the client, that you really, and how do you really figure out how to really start that process of client centering? And so I had really an opportunity to really talk to a couple of people at the School of Social Work, and we started to develop a practice set, and then we developed a curriculum, and we were also working with a multidisciplinary team that met in Brooklyn and New York City. And so this is a long-winded way of saying that we were able to get a change agent award based on the fact that we developed this curriculum, but we were going to evaluate it and evaluate its ability, its efficacy. And in addition, we were going to use that. We were using that award to pilot the curriculum with New York City Adult Protective Services, and the pilot was successful. Then we did a presentation at NAPSA, the National Adult Protective Service Association's annual conference, and we were able to connect with Texas Adult Protective Services, and they were interested, and so we customized a version of the practice set for Texas. And so why, when the RISE, I'm the late starter on the RISE team, and so when they all came to me and they said, we started having conversations and join the team, and we think it's important to engagement to have practice. Again, another Sally Field moment. They really like engagement. That's great, because I think engagement is the key to everything. I think it drives discovery. It really sort of underscores the strengths or values perspective, because you're really trying to distinguish the client from all the other clients. I think one of the habits that we can tend to get into to think of clients as sets of clients rather than individuals. And what I really love about it is that the idea of using engagement skills, not just with clients, but also with people who surround the clients. And that can also include the people who might be abusing or exploiting them. And then the other use of engagement skills that I think really underscores another of RISE's strengths is the use of it to engage with other service providers in terms of how we can sort of do the work around clients that have very, very complicated or difficult needs. How that all comes together, I think, is really sort of underscores how, again, client-centered work really can be effective. And in there, I think, is where you can also provide a sense of equity and inclusion with clients who really get to be seen as themselves, not as sort of a category of clients. So, I think, well, you don't know, why would I say that? But I think engagement as a central practice in RISE is one of its great strengths. And David, I think you're going to talk a little bit about the client relationship.
Thanks, Jeff. Yes, that's actually up next, and so just really building on what Jeff was saying, and this whole engagement relational kind of piece is really centered in the work of RISE, and so we wanted to sort of measure to what extent is this happening, and so we administered this sort of blitz survey at one point, and asked active clients, and so among active clients, about 82% reported that there was collaborative agreement that occurs much or all of the time, and about 88% of active clients believe that advocates respected their choices much or all of their time. So I think certainly this is indicative of that relational piece. So I'm going to keep going here. And again, among active clients, in terms of the acceptability of the program, about 77% have indicated that the program has met most or almost all their needs, about 90% saying being mostly or very satisfied with the services, and about 78% reporting definitely coming back to the program if they needed help again. The following proportions of active clients reported change on these outcomes as being somewhat or a lot better since they started their work with RISE. And so you see things related to personal stress, personal worry, quality of life, self-efficacy to cope with challenges and make safe decisions, knowledge about informal and formal supports, and then progress on case goals. And then we were looking at sort of an analysis, and credit to Stuart here for undertaking this analysis. We wanted to kind of compare, the whole idea here is the hypothesis that, the partnership between APS and RISE is really what's going to lead to robust results. And so we compared cases that had been exposed to this partnership that received both APS and RISE services, again, kind of both playing critically important parts of the overall puzzle, to cases that didn't receive the partnership. And what we found is that after accounting for the fact that cases within this partnership were more complex or severe, given their history of substantiations, that cases that had been exposed to this partnership had a significantly lower likelihood of re-referral or recurrence or recidivism back into the APS system. And so that was a really kind of exciting finding, I think, for all of us, that it's having this kind of impact. And it really kind of highlights that both APS and RISE play critical roles within this overall response process. And it's the combination of working together that's really most effective. And we'll continue to look at some of these things. And so this is more of a sort of a visual representation of that finding, that again, the blue is the partnership and the red is cases not in the partnership. And you can see that along the bottom here, it looks at, depending on the number of previous substantiated allegations in both groups, as the number of previous substantiated allegations goes up, so does the probability along the left there of a repeat investigation. But certainly those cases in the partnership have a much lower probability. And then this kind of gets at the same thing, but again, at very specific scenarios. So we tried to look at this comparison on the outcome of recurrence based on specific types of cases. So for example, if there's a history of self-neglect, again, the one on the right is the partnership, and the one on the left is cases not in the partnership. And you can see about a 40 percentage point difference. History of financial abuse, but a 35% percentage point difference. When there's a history of physical abuse, I'm doing math very quickly in my head here, but about a 45 percentage point difference. And a history of self-neglect and financial abuse. And you sort of see a similar finding replicated regardless of what the kind of history of the case was. You see a similar finding. We also did more of a qualitative evaluation, specifically from the perspective of APS practitioners. And so at the time of that initial 3-year project, there were APS practitioners at both of the offices who had the opportunity to make referrals to and kind of work in partnership with RISE advocates. And so we interviewed all of these APS practitioners about their experiences in the partnership. And these are just some of the findings, that we had come out of that work. And so certainly a common sentiment that there was, a perception that RISE was complementing existing APS services and, was able to address needs that are sometimes beyond the scope of APS or, kind of getting into more longer term needs. And certainly appreciation that they could make referrals to RISE for cases that were both certainly met the threshold for substantiation, but also cases that didn't necessarily meet the threshold for substantiation, but that they had sort of assessed as carrying enough risk that if unattended to or unsupported could potentially bubble up or escalate. There was a perception from their perception that RISE was, this partnership was reducing repeat referrals. There was an appreciation that the ability to integrate others into the case, such as the perpetrators or other family members. There was an interesting sort of common sentiment among APS caseworkers that, that they actually found that it contributed to their own kind of psycho-emotional well-being, that there was sort of a comfort or sort of a reassurance attached to sort of being able to hand a case, to work with advocates or hand a case off, and even to knowing that work would continue even if the case was closed at APS, and certainly an appreciation, opportunities for sort of case collaboration and mutual support between APS practitioners and RISE advocates. So I'm now going to hand this over to Patty and actually to Ella and Jacinta to go through some sort of more kind of on the ground case examples.
Yeah, so as I noted earlier, 2 of our advocates, Ella and Jacinta, are here today and will be presenting on each of them on a case, so you can get a sort of a taste of what the work looks like on the ground. And I will hand it over to them.
Thank you, Patty. Hello, everyone. I'm so thankful to be here with you all today. My name is Ella, and I work as an advocate with EAM alongside my colleague Jacinta. Today, we will each share with you a case that we believe sheds light on the modalities of the RISE model and their efficacy. The names included in these case reflections have been changed to protect the identity of those involved. I had the privilege of advocating for Heather, a 91-year-old female living in Androscoggin County, Maine, with her daughter, Lisa, who cares for her and acts as durable power of attorney. Heather is struggling with critical dementia and needs a lot of support with daily tasks. Heather had recently moved to Maine within the past year and has 6 children, most of which live in New Hampshire. I spoke with the APS caseworker about this referral before reaching out to the family and learned that there were allegations of emotional abuse. There's also animosity between Heather's children, especially between Lisa and all other siblings. It was reported that the client can appear pleasantly confused, but she also struggles with agitation, aggression, and public outbursts. There were no outside agencies or professional help for the client, and Lisa was attempting to care for Heather on her own. When I spoke with Lisa for the first time, she stated multiple times, "I can't do this anymore, and I'm at my breaking point." Heather was referred to APS from a doctor that they had visited, where the doctor observed Lisa talking down to Heather and treating her like a child in their presence. Throughout the development of this case, I collaborated with the APS caseworker to monitor the case and review any concerns coming up by others involved. These concerns included a broken watch from Lisa grabbing her arm, excessive notes with directions on how to do daily tasks, and punishments if she does not do these tasks. I arrived at the home to visit with Heather and Lisa and to meet with Heather in private to ask her what her goals are without the presence of her daughter, in case her opinion would affect Heather's decision. In her words, she states, "I need to leave here as soon as I can." And when I asked her where she would like to be, she said close to family. I explained to her what this would entail. It would involve going to a facility where she can be cared for, and she agreed that this would be the right choice for her. Heather exhibits the following strengths. She is persistent, she communicates openly about her wants and needs, and she is family oriented. Her main goal is to be placed in a nursing facility that is near her family in New Hampshire. I teamed with 2 other daughters in New Hampshire, Brianna and Sarah, in order to work with them to find a solution to moving their mother to a nursing facility. This was a difficult task because we did not have time to spare, and the process of switching her address, Medicaid, and financial details, all without actually moving the client to this state, can be lengthy. It was evident that the daughters were upset with the system, and they were leery of trusting information. They questioned my knowledge and questioned my role on multiple occasions. Despite the distrust, I continued to keep my actions client-centered and focused on the ways to help Heather to leave the emotionally abusive situation while honoring her and her family's requests and preferences. Facilitating and communicating became an important aspect of this case in order to allow more information to flow between family members. The relationship between the daughters was aggressive and contentious, evidenced by abusive language, triangulation, and patterns of calling the police. Consideration was given to a protection from abuse order. Despite the family conflict, I steered our conversations and interactions toward solutions. Heather moved into a nursing facility in New Hampshire within only 2 months of opening this case. An officer was present during the process of Brianna and Sarah picking up the client and her belongings from Lisa's home in order to minimize conflict between family members. This speedy resolution highlights the benefits that the RISE model has on advocating for older adults and showcases the potential that this role as advocate provides in making quick progress in order to prevent abuse. Heather was in an emotionally abusive living arrangement, and the daughter, Lisa, lacked knowledge of how to care for someone with critical dementia. This case reveals the intricacies of family dynamics and proves a need for this service to permeate the family dynamic and able to make progress. Lisa relayed to me at closing that she did not believe they would have been able to make this much progress in such a short amount of time without the help from an advocate. Thank you so much for listening. And now my colleague Jacinta will present her case.
Thank you, Ella. I have been working with my client, Jim, and his wife, Nora, since the beginning of April. Jim and Nora are currently 89 and 76 years old and rent a home in a small residential community in Aroostook County. The APS report was initially made in regard to alleged physical abuse from their 13-year-old adopted son, Chandler, onto his father, Jim. This was not substantiated, but mental, emotional, and verbal abuse were all legitimated by APS. Chandler has an extensive list of mental health diagnoses and is very large for his age. Chandler often punches walls, breaks electronics, hides weapons, attempts to destroy Jim's walker and oxygen tanks, and regularly threatens harm to Jim and Nora, as far as telling them how he will kill them. The main goal of my client, as stated by Jim, is to get Chandler professional residential help to ensure that his needs are being met and that safety might be restored to them. It is not their wish to simply have their son removed from the home. Rather, they want him to have the tools to navigate the world safely and to heal from past traumas that are informing his behaviors. Chandler's level of need is high, and finding him placement is challenging and is going on a 3-year process. Last October, days after finally receiving an acceptance for placement in a boys program in Massachusetts, Chandler was charged with gross sexual assault and his acceptance was revoked, thus leaving Jim and Nora home with Chandler all day, as he was no longer allowed to go to school or allowed to be outside around the other neighborhood children. His case manager was told that his eligibility for residential placement would be renewed only after an outcome in court. After 2 failed appointed attorneys and postponed court dates, there's finally a date set for June 1st, 8 months since the legal process began. Jim and Nora, on the basis of having limited supports in place, have developed a strategy of calling the police when Chandler's behavior escalates to unsafe levels. The police then drop him off at the hospital, who simply discharge them back to the parents, further jeopardizing their safety. Although Jim is my client, Nora is the main communicator for the couple, and she is very willing to ask for help and to present their problems honestly and directly. Both of them are strong advocates for Chandler and have rejected the notion of a juvenile detention center being what Chandler needs. Once Jim and Nora's vision of their preferred outcome was established, my work could begin in supporting them. Through following breadcrumbs of information that began by calling a group home turned youth homeless shelter, I obtained the contact details of a well-known DHHS child crisis worker. After communicating the urgency of the case with her, I was put in touch with the behavioral health program coordinator who has been covering Aroostook County, as well as the new area coordinator who brings extensive experience to the role. Both were willing to join the team after hearing about the case. After inviting Chandler's case manager, the first meeting was set, where the advocate and case manager went to the home and the DHHS members joined via Zoom. Thus began weekly think tank sessions devoted to supporting the family and promoting the exploration of new service routes. For example, through advocacy, Chandler's direct care hours have been increased, and he is taken out of the house 5 days a week with a behavioral health professional. Further, Chandler is now pending approval and will be placed at the top of the waitlist for home care therapy, a program which often helps secure residential placement faster while providing a holistic and family-centric approach to Chandler's care in the meantime. I connected with a local mental health provider's mobile crisis program to perform their own evaluations and create a safety plan with Jim and Nora in the case of a crisis, despite them refusing to work with Chandler in the past. Now a team is actively searching for an available crisis bed and regularly checking in with the family. Finally, materials are being gathered and evaluations scheduled so that Chandler's case manager is ready to submit the new residential application on June 1st after the court hearing. Some days, advocacy for Jim and his family looks like meeting with the whole family to speak openly about the harm that was done and in which ways Jim and Nora foresee repairing relationships. Other days, advocacy looks like coordinating with Chandler's BHP worker and local law enforcement to secure a weapon that Chandler has hidden on property. As progress is made in reaching their goal of helping Chandler, it is my hope to advocate for them in addressing some of their own personal concerns related to health and finances. But as is the nature of true client-centered work, this shift in focus will only occur when Jim and Nora decide for themselves, and I will continue to support their self-determination and goal setting. In the meantime, we can appreciate that within only a month and a half, Jim and Nora went from having the sole and periodic presence of Chandler's case manager in the home to over 10 professionals involved in this case, who are working collaboratively to ensure Jim and Nora's safety while navigating a tricky and priorly dismissive system. Nora has shared with me that she finally feels like people are listening. As you have heard in both of these case examples, the core RISE modalities are integral to the effectiveness and viability of an advocate's work. Thank you.
Thank you so much, both Ella and Jacinta. I'm just amazing, work to hear, and really, really appreciate you taking the time to share those cases with us. At this stage, I'm going to pass it over to MT.
Thank you, David. And yeah, thank you, Ella and Jacinta. It's really amazing to hear about your work. Just real briefly, we thought that we would talk to you a little bit about some of the new horizons of RISE. Intuitively, people have been searching for a long time in this field, in the elder mistreatment field, for both evidence-based interventions and better ways to do the work to fill the gaps. Everybody knows what the gaps look like, but we've struggled to try and fill them. And so that's really how we designed RISE. And we're excited because intuitively other places have said, oh, that kind of makes sense. We would love to try that. And that includes in David's backyard in Toronto, where there is no APS program, but they said, oh, we would really like to try that. So David is in the process of standing up a freestanding RISE program there. Stay tuned. Next year, hopefully we'll have both, the story of how that's going and maybe even some data. We also got Aaron talked about the ACL grant for the initial program. We got a follow-on grant last year to do a couple of different things. We all know that substance use is a big issue in many elder mistreatment cases and some self-neglect cases, but we don't know that much about exactly what the mechanism is, like how does that work? And then even more important, how do we address it? And so that new grant is putting a special focus on that issue, and Patty has been working closely with professionals who have expertise in that issue in the context of elder mistreatment. And also as part of that grant, we'll be expanding RISE to New Hampshire and standing up a program there that also is going to be looking a little bit at the substance use issues more in greater focus. And we've also been using the lessons that we've learned in RISE and trying to look at what would it mean if we started to use those principles in criminal justice cases, and specifically either in augmenting a criminal justice intervention or as a diversion, so that if a defendant were to go through all the steps and maybe work, meet some, for example, drug court requirements, then they could have charges dropped. So we're really excited to be working closely with some prosecutors to figure out how to best adapt those principles. And are grateful for funding from the Maine Health Access Fund and the Bingham Fund to do that work. Next slide, please, David. So this is a slide that makes me tired. This is the research. These are the research articles that we have produced as part of this project. And one of the very intentional goals in every part of RISE is that we want to contribute to the evidence base in the elder mistreatment field, because we have done an absolutely terrible job nationwide of trying to figure out what works in any sort of evidence-based way, either in terms of interventions or in prevention measures. So it's not easy, but we are so grateful to all the team members to do their best to collect data, and then to our researchers for analyzing those data and figuring out how do we assess efficacy with the kinds of data that David presented earlier. So this is really exciting work. Next slide, please. And so this is what we call the secret sauce slide. Aaron, feel free to jump in here if you want, but essentially, we tried to distill down what is it that's made it work. And I think collaboration at every level. You heard Ella and Jacinta talk about their work, and they work really closely with the APS workers on those cases. Patty and Aaron have one another on speed dial and have had hundreds of conversations about this work. The researchers and the practitioners have had a jillion conversations. And also all the team, the whole team have had conversations. And so it's so that's a really, really important component of that. The data collection, as I said, it's not easy, but it is possible. And I feel like it's an ethical obligation in doing this work to try and, as we learned in grade school, to show our work. And so we're trying to show our work as well as possible. Ongoing communication, I mentioned that it's sort of part and parcel with the collaboration. And then to be really focused on what the goal is. Jeff mentioned it, others have mentioned it. What do the clients want? And to really center all of the efforts, whether it be the research or the practice or the policy on what makes us more effective. And then, you know, the trust and respect, I think, is not to be underestimated. And we try to put ourselves in one another's shoes and to say, okay, what is it that's hard about your job? What is it that's hard about your other, you know, everybody's jobs, because everybody has real challenges, but they're very different kinds of challenges. And so we're trying to really approach one another and the work with respect and trust. Next slide, please, David. And we, you know, those of us who are part of the national team feel like we owe a huge debt of gratitude to those of you in Maine at every level for taking a chance on this program, because it would not exist without you and without the, you know, without the dedication to every part of the process that I just went through. And, you know, that's true of the advocates, of all of the EAM leadership. It's true of APS workers, of management at APS, of the commissioner and the governor herself, for the dedication to asking questions, asking really hard questions, to data collection, to trying something new, to innovating, and to testing it along the way. So thank you all. And the evidence is really, or as my father used to say, the proof of the pudding is in the eating of it. And the interest that we're getting nationwide has been, it's overwhelming and exciting at the same time. And it's because of what's happening in Maine. And you're really leading the way here. So thank you. David, back to you.
Okay. Yeah, thank you, MG. I think at this point, we're going to open it up for questions. We've got our contact information here in case anyone wants to reach out. And did anyone else on the panel want to make any final comments before we open it up for questions? Okay, so let's do that. You can certainly feel free to raise your hand, leave a chat question, or simply unmute yourself. Oh, sorry. Please ask questions in the chat box. Thank you, Chris.
David, as you get going on this, can I ask you to stop sharing your screen and maybe we could see if anyone's having trouble putting information in the chat box?
Sure. So. Do you want me to read them, or
are case managers being trained more about RISE in the community? I don't know who wants to field that question. Are case managers being trained more about RISE in the community?
I guess.
Patty, I don't want to throw you under the bus. Yeah, okay.
Oh, no, go ahead, Jeff.
No, I was going to throw somebody else under the bus. So,
no, was it going to be me?
No.
I don't know that they are necessarily. You know, it's sort of a somewhat of a distinct role, I guess. But we certainly hear from programs, you know, in other parts of the country about the possibility of doing training, and we're kind of moving in that direction, but sort of looking ahead to that, I would say.
And Pat, you had the question, how about capacity to respond to these cases in Maine? So are you asking specifically about our capacity to respond to the referrals that we're getting from APS?
Correct. It sounded like there's just a handful, maybe a little bit more than a handful of folks that are actually assigned to these cases. Is that correct? And what's that capacity level? Because it sounds like they're very time intensive.
Maybe Patty or Polly can speak to that, but I know we just doubled our staffing. Recently, we have 11 advocates now placed all over the state, but I'll hand it off to Patty or Polly.
Yeah, I mean, right now, it's always sort of a challenge, but right now we're balancing capacity with, balancing need with capacity. But as the program, I think gets, more people know about it and more referrals are made, we're always trying to figure out how to manage capacity, Pat. It's a great question. Right now, I think we're doing pretty well.
Are there ever roadblocks or barriers to collaborating between agencies or policies that could be changed?
I think is that a Patty question? Yeah, it's a Patty question. Our role is to work within existing systems and try to access services as they exist. So we all know that there are resource needs that there are needs in the community that outweigh the amount of resources we have. I think that we learn every single day in the work with our clients about what is more easy to access, what's available. In communities across the state, it's very different. But one of the hallmarks of our program is that we look across the community. We're really creative about trying to find resources that are not maybe typically visible, and supporting our clients in working through systems and encouraging systems to work together. So that slide I showed about the number of contacts our advocates make on behalf of clients, I think is representative of the attention we pay to helping to link services for clients and access resources where they don't exist, and celebrate them where they do.
So this is a question for either Ella or Jacinta or both. What challenges did you experience in developing the think tanks for your clients? And how did you overcome those challenges?
I know.
Well,
Oh, you go out.
okay, sorry. Yeah, I'm actually not familiar with the think tanks phrase, but I would say the biggest challenge was that there were so many different people involved within this case that had opinions and different ideas about how things could get done. So it was that aspect of it was difficult for all of us to stay on the same page. So just kind of working with all the family members to get this resolved as quickly as possible was probably the most difficult aspect of the case that I presented.
Jacinta, do you want to say anything?
Sure. For the case that I presented, the first challenge was probably finding out who to ask, because I was kind of starting out at like kind of a square one. And I'd say I overcame that challenge just by being willing to make contact and ask questions of like organizations that they themselves might have not been able to help. Like that first youth homeless shelter that I reached out to, I just knew they used to be a group home, and I just wanted information on what happened when they'd get referrals that were over their level of care and who would they refer to. And then just through having conversations like that, then I'd get someone's name and talk to them, of course, with the client's permission the whole time and releases. And then also I'd say overcoming the challenge of just being able to look at the case with fresh eyes, knowing that I'm coming into it at this moment in time where, you know, some things have been explored before, but not letting that discourage me from trying again with this added support. So I hope that answers the question.
This next question, I know we've had this question a few times, like, are referrals only made by APS investigators still? We do get calls sometimes saying, can it come through some other mechanism? So I know that that's still the case with our program, but maybe folks on the team could talk about how this might be expanded to non-APS or what that might look like, or is that in the works?
Maybe David, you could talk about what you're doing in Canada.
Yeah, sure. I mean, so I mean, in here in Canada, we don't have an APS program, and so it's interesting. We're still sort of figuring out how that'll work, but you know, this is a model in which cases will need to be referred from any kind of source. But I mean, in some ways, it's I would say more difficult. I mean, I sort of wish we had an APS program because you know, just all of that front end work that they do, and so I mean, we'll see how that kind of rolls out, but it will have to come from multiple sources.
That's it for
Can
questions.
I just add one thing to what Ellen, Jacinta, and Patty said about the systems? I mean, I think one of the things that's so vivid, and you know, I generally work at the sort of at a 30,000 foot policy level, is that there are services, and Patty keeps reminding us of this too, but there are lots of services. We just, they're all in their silos. And so one of the things that I think is so impressive about the case, about the work that Ellen Jacinta presented, is it's a process of trying to break down those silos, and that's not a one and done thing, that it just requires a sort of relentlessness and calling and getting different people to work together, and maybe in combinations and permutations that they're not accustomed to. And so I think that's one of the big lessons of this work that hopefully we'll be able to sort of distill out a little bit. But I think it's I think that's a real structural barrier that we have as a society, and that we're hoping to make a dent in.
And actually, there's a if you're interested in hearing more about these kinds of, there's a great book coming out very soon called The Measure of Our Age on July 18th by our very own MT Connolly, who I believe is going to be talking more about these things. So just a shameless plug right there.
I wanted to make one, yes, MT's book, which features Maine, and the work that we've all done here, this whole team, on this webinar. I want to note one more thing about systems work too, and Jeff brought this up when he talked about engagement, that, you know, when we think initially about engagement, we think about it with our clients, but the same sort of reciprocity and respect and trust we establish with our clients is the approach we use with service delivery and professionals with whom we work, that, you know, we all have a perspective. We all come to the table, you know, from an agency, from a from a community, with our own perspective, and only in understanding the perspective of other service delivery providers are we able to create those teams. So I want to reinforce that it is really, when we build those teams, a multidisciplinary response, and that can only come when we demonstrate respect and understanding of other people's perspectives, limitations, and resources.
David, I'll pause for a second, just if there's any final wrap up. If not, I'll pause. All right, very good. It's actually a perfect time. Thank you to you and your team for bringing this update back to us. It really is amazing work, and I'm a practitioner in the field at the lowest level. At least that's where I perform best. And to hear these stories of on the ground successes of someone who had very little for support to where they are now, I mean, there's no better. We're eating pudding all day long that way, right? It's just great to see, great to hear. And I wish you all the best success, not only here, of course, in Maine, but what you're doing outside of our state to bring this to people who really need it. Just my tip of the hat to all of you for the solid work there, and wish you nothing but continued success as you continue with this project. So thank you for being here again. We've made it to our first break, and coming in after lunch. I think you've all earned it. So we're going to put up a poll question. So look to answer that. It's the same question as yesterday, but selfishly, not yesterday, it's Tuesday. Selfishly, I'd like to know the result of that as we bring our next panel of discussion. So feel free to get up, relax, walk around, but stay logged in. We'll plan to be back here at 2:25. So thank you very much.
Thank you.
Thanks for having us.
You need to scroll down on that poll to be able to submit it. I know that that's something that people didn't realize last time.
Welcome back in, everybody. I still owe you about a minute, but before we start our next session, I just looking at that poll, thank you all who took that. It's helpful for us. I should say it's helpful mostly for me to see who's here today. And it was probably like the same as yesterday, but as we move on to this next block, I see that almost a third of you here, not quite a third, but 24% social worker, counselor, mental health professional, but a third of you, this is your first time. So again, very excited that you're here, joined us, hopefully be able to take something away, or we can take something away from all of you who are just joining us with fresh ideas, fresh thoughts, great attitude. So all of that's going to go together very well. So our next block, we're going to spend about an hour on the topic of a partnership between law enforcement and behavioral health specialists. As you can see, I'll read it just because all of you may not have it, but we're going to discuss the ways that behavioral health coordinators embedded in law enforcement agencies can help improve community relations, decrease repeat calls, and provide vital interim services by addressing major areas of concern. Today, this is the Elder Abuse Summit, so that is one of them, but we also are talking about mental health, substance abuse, housing, domestic violence, all the things, not all the things, but a lot of what we heard on those two examples from Jacinta and Ella. So it automatically, to me, validates this program that has been happening across Maine for many, many years, but for the state police, it's new to us. And I'm curious to know as we go along, the number of you out there in that social worker, and this is my attempt not to offend anybody, but social worker, mental health professional, behavioral health specialist, to me, they're all interchangeable. We call them different things, but that role, that advocacy role, to me is all interchangeable. But how many of you have actually had the opportunity to utilize that in some form or fashion in your advocacy role? So with us here today, we have LCK Banks, who is with the state police. We have Joe Friedman. She's actually with Westbrook PD. I see her there. Hi, Joe. Thank you for joining us. And we have Jenny Moody, who is also with the state police. But I'm trying to get an idea of across the state by integrating both our agency and Westbrook PD as to what this program looks like for all of you who may not be familiar with it. And the way that we're going to attempt to do that is I'm going to facilitate a series of questions to each one of these ladies. And with their response, hopefully we'll educate all of you of what it is this program is, where it may be going, and maybe with some help from you, some things that maybe we can focus on. I would like to see some questions pop up, and I would ask you to type those as they come to mind. Some of them may be answered as we go along, but at the end, I do want to save time for some really, really good question and answer sessions that between all of us we can do. And also, if time allows, I sent Jacinta a message. It sounded like she had some interaction with a behavioral health specialist up north, and to see what that was like for her. So all of that being said, the bios for our behavioral health coordinators, mental health professionals are attached. But when I ask them the first question, I will just have them introduce themselves briefly and let you all know what they have for credentials behind them, whether it's a LCSW, LSW. Some of that's important for all of you to know because a vast number of you hold that same credential. So before we, the first question I'm going to ask is to Elsie, and she may go over this, but she's assigned to the South. And understanding that, I wanted to ask her a question that surrounds homelessness, because that's something that we're seeing a lot of, and it's not just, it covers all ages. But the question that I've created is understanding that the population to the South is more dense. Homelessness is occurring in greater numbers than they are where I am in the Augusta area. Can you tell us about your role in how you're managing this challenge? So that'll be my kickoff point, and Elsie, I'll throw it to you.
All right, thank you. Like Pat said, my name is Elsie Banks. I cover the Southern Field Troop. which covers areas from York County, Androscoggin, Cumberland, some of Oxford, I-95, and also 295. So we have a really big catchment area. Quick bio about me. I'm a U.S. Army veteran, worked Department of Corrections for a few years. I got my social worker license when I worked in the Lewiston DHHS office as AHL protective assessment worker. I did that for 5 years and left to work for the medical examiner as a medical legal death investigator, which I am still a board certified death investigator. Did that for 5 years and had to make the really tough decision to leave that job. But I wanted to get back into the mental health field. So I worked at Spring Harbor for a very short time and then did case management for kids with autism and other developmental disabilities. And then this job opened up and I jumped on it. So, and they hired me. So I'm really excited to be here. We started in January. Jenny and I both started together. So we've kind of, with the guidance of our lieutenants and the majors, have kind of, we're just developing this program. So we've been in touch. I see a lot of familiar faces, and Joe, who's also speaking today, has been a huge support for both of us in trying to get a program together and with training and everything like that. So yeah, I'm so glad to answer this homelessness question because I actually just got a phone call from the lieutenant that runs Troop I. And today and yesterday, the city actually tore down a camp that had 80 to 90 tents on the Bayside area in Portland. It was all over the news. If you Google it, you can watch these dump trucks just picking up these people's belongings and just throwing them in the trash. So that's, they had asked me to go out today to go meet with some of these people and just see if there's services that we can offer them. A lot of them already have case management or they're in some type of treatment program. So the biggest obstacle we're running into right now is housing, is actual, like a physical location where these people can stay. So we're looking at, they just opened a new shelter in Portland with 200 plus beds that was filled the first night. The very first day it was filled. And it's not just the unhoused population that is seeking shelter. We also have a lot of asylum seekers that are in the Portland area as well. So just kind of creating a balance between, you know, unfortunately, who gets what and when. So yeah, we work closely with the Maine Department of Transportation, which covers 295, the areas of 295, and the Maine Turnpike Authority, which covers I-95. So for us as a state police, we're in a unique position because the highway and turnpike are ours, but sometimes the physical ground where people are residing is actually a city. So we're trying to work in conjunction with like Portland Police Department, South Portland Police Department, and kind of their liaisons to figure out what we need to do and what we can do to help these people. And it's just unfortunate, I think, with the warmer weather, it's just going to increase. So unfortunately, I have no answers. And just getting that phone call, I mean, literally an hour ago, was just kind of disheartening. So I'm really bummed, but.
Yeah, Elsie, thanks. And just though again, a community solution. It's a big problem. It didn't happen overnight, but some concerns in the law enforcement side as we think about major roadways like the Maine Turnpike in 295. When I was speaking with Elsie about this, and we talked about this particular question, is there are people that walk across those roadways at cars going 70, 80, 90, 100 miles an hour, and you don't expect to see pedestrian traffic out there. But if services are on one side of that roadway or either roadway, and they live on the other, that's a huge concern for us, because, you know, you're looking at a potential increase of fatal traffic crash. And that's something that we didn't have to deal with 2 or 3 years ago. And now, because of what's happening, the people coming into the state, that's a real concern. And to have somebody, a community of behavioral health professionals or social service workers to go out there and address those needs, can we mitigate that risk? And that's a concern that I have. So Elsie, thank you. I appreciate that. Again, community problem there with a community solution, as we talked about earlier. So I'll ask Joe Friedman, who is not listed on your bio, so if she could introduce herself when she answers this question. But I asked her to tell us about the history of social workers and law enforcement working together, because although it's not new, it's new to us. And then what role, what training is associated with that. So Joe, go right ahead, please.
Well, good afternoon, everybody. I'm really excited to be a part of this and happy you're all here. So when it comes to the collaboration of law enforcement and social workers here in Maine, back in the day, it was Ingraham. Now it's Opportunity Alliance, but Ingraham and a group of community partners recognized the overlap with people with mental health and substance use issues and their overlap with law enforcement. And they created by grants a position that I ended up filling in 2006. So that started in the late 90s. I started in 2006 at Portland Police Department as that mental health liaison. So the role really at the time was just carry a radio, have a call sign, an unmarked car, and go with police to anybody who's suicidal, homicidal, or acutely psychotic. It was a very broad definition. And after 4 years, I really fell in love with it. I came into the role with a master's in clinical counseling and really had never had much overlap with law enforcement. And I really loved it. And I've expanded that program to include peer support, training of law enforcement, and worked really hard on that for a long time. In 2010, we got a grant from the Department of Justice, a law enforcement mental health grant that allowed me to become the behavioral health coordinator. From there, I started an internship program. So we had interns from the master's level go through that program and expanded it to the substance use liaison. And now it's an entire behavioral health unit. I went over to Westbrook Police Department in 2021. And we have a recovery liaison there, myself, and community policing as well. So the social work and law enforcement overlap has existed for a long time. In Los Angeles, they started it in the 90s as well. And so the co-response looks different kind of everywhere. It kind of fits that program. In 2010, we had become a learning site. So we helped build these models across our state and also across the country. And it depends on the agency and the community. So co-response can look like either, so for myself, I choose to have a separate car and I respond either with officers, I can get dispatched with them, or officers can be on a call and request for me to respond, or I can do follow-up. And then the alternative response piece looks a little bit different. It's more of like I had 2 of these yesterday where we had family members calling dispatch knowing what I do, me talking with the person, talking with the sergeant, and feeling like it's safe enough for me to go. It really wasn't neither of them were police issues necessarily. They were more mental health and support situations. And then I can connect people with services. I can assess for hospitalization. I can advocate through that process. So we have now about 17 police liaisons in Southern Maine, and we also have the options program as well. The training kind of came from experience and some mistakes along the way, and some things that I learned that could be better. An example would be I was on a call and thought that I had the person willing to go to the hospital, and next thing I know, he takes off on me, and officer had to push me out of the way, and he had to be restrained. And then after the call, the officer said, you know, I'm sorry I had to push you back there. And I said, no, actually, I just want you to teach me where I should be standing 3 minutes before you would have had to push me. You know what I mean? So we ended up building that kind of relationship. And from that, I do have a training guide that I give people, including dispatch communication, scene safety, tactical safety, really knowing the law and what officers can and cannot do. That makes me a better team member with them, knowing what our roles are and what they can and can't do, and learning from their experience and their expertise, because a lot of people pushing for social work with law enforcement, I ended up right away learning they're the best de-escalators they are, right? Like us clinicians, we're trained in having people wanting us there, and officers are actually really good at de-escalation and really good at being effective with being able to just start a conversation with people who don't want them there. So building those two pieces together.
Great, Joe. Thank you. I appreciate it. And thank you for being here with us today.
Absolutely.
The third question, to kind of shape this and understand what it looks like, I'll ask Jenny Moody to answer. But when law enforcement agency decides to hire a behavioral health specialist, and remember that's all kinds of different terms in there, what benefits do we as an agency acquire from your training, education, and experience?
As Pat said, I'm Jenny. I am a licensed social worker. I have been for 17 years. I have a little bit of a variety. I started out as a children's case manager. I've done alternative response for Child Protective. I've done a school social worker, been a supervisor for Section 28, and most recently was a medical social worker. And then started this in January with Elsie. I am based out of the Central Field Troop, so I have 7 counties. I have Lincoln, Knox, Waldo, Saginaw, Franklin, Kennebec, and Somerset. So as licensed social workers, we see things and assess things differently than law enforcement would. We have the knowledge and connections with the local resources. One of the big goals and benefits of having us be partners with you guys is that we have the time to follow up with these calls, that even after calls are closed, that the troopers don't have time to follow up with. We can work with the person and make sure that, or at least try to make sure that they're getting connected with local resources so that they're not repeating the cycle, try to break the cycle of having calls come back into law enforcement when it's not really a law enforcement situation. A lot of times these calls are coming because it's a mental health issue and they're not getting the help that they need. The other thing is we spend a lot of time with these local agencies, building, collaborating with agencies. I know myself, Elsie, we're on a lot of task force to build these relationships with that we sit on every month. I'm on both Kennebec, Somerset Domestic Violence Task Force, the Substance Abuse Task Force, the Reentry Recovery Program. So by us being out in the community and having these relationships, when we get these cases, these referrals from the troopers, we know where to turn to for help to try to get these people connected to. We work closely with the options liaison. So when somebody's having substance abuse, we can connect them with them, the NAMI. It's just really trying to break that cycle. Another one is, even though we're not meant to be for the troopers, they can turn to us if they need brief support for something, they need help finding resources. I've had a couple come to me because they need either something for their family, a counselor for themselves. I know Joe in her role, because she does co-respond if she has officers that are at a scene for a long time, as simple as going to get them coffee and something to eat. An example of a call that has nothing really to do with mental health, has to do with mental health, nothing to do with law enforcement. If somebody wants to apply for BRAP, they have to have a homeless letter from law enforcement as one of the agencies. So we had a trooper that got a call from somebody that needed the letter. It the person didn't have a case manager. Most of the times, or a lot of times, they do have a case manager when they're applying for BRAP, because there's a lot of steps. They have to have applied for Section 8 already. They have to have the diagnosis. So this person also needed help filling out that application because they did not have a case manager. So that got referred to me. I was able to work with that person, work with the social worker at the doctor's office to help track down the diagnosis, helped him fill out online the Section 8 housing because he had not done that yet, and just walked him through all the process, worked with KVH because actually he was not going to meet the deadline. And without me, that he probably would have fell through the cracks because nobody else knew how to do that process.
Jenny, thank you. And just to follow up with some of the things that she said, much like the role we do here with the Maine Council for Elder Abuse Prevention as it relates to law enforcement, the calls that we get sometimes just don't fairly squarely fit with us, and we need to reach out to a community partner that is best to serve that need, whether it's a long-term need, a need right now. And with these behavioral health specialists embedded with us, with our agency, we now have the option to pass off this concern to Jenny or Elsie, at least in our agency, to say, this is what this individual needs right now. And she said it, they have time, dedicated time, to either further expand on what challenge that they're experiencing at the moment, and then what, and I call it a Rolodex for all of you new generation. It was this thing that you put on your desk and you spin, it has all kinds of contacts. You didn't just find it in your phone, but they bring a Rolodex of contacts in the community for that specific need. Because I'll be the first to say that we're really good at putting out fires, but we're even better at moving to the next fire and not trying to figure out how that fire started. So if we could hand that roles and responsibilities to a behavioral health professional that has a matter that's not criminal, but needs to have the focus of social services to help them get out of what Jenny said, that cycle, that rut, to get them to a better place so they can get back on the path to being that productive member of society. That's our goal, to have somebody not be a repeat caller that needs something because a need is not getting met in that role. And there's nothing more beneficial to hearing, I'll go in and to ask Jenny, hey, have we heard from so-and-so? And her response is, no, we haven't had any calls because I hooked this person up with this agency and that was the fix. So that's fantastic for us in all of law enforcement. So we can focus our narrowing amount of resources on the matters that do require that police response. So Jenny, thank you for sharing that information. Elsie, I'm going to come back to you for this question, but how do you obtain referrals from our agency? Kind of educate all of us here how that happens, and what does a typical response look like, and how do you utilize your community partners in the southern part of the state?
Yep. So the referral process, I tend to get referrals in several different ways. Being with the Maine State Police, they don't do like a typical briefing or like roll call like some agencies do, that all get together at the beginning of shift and then get their assignments and head out. We're just spread all over the place. So I haven't really had a meeting where I've sat down with all the troopers and been like, this is me, this is what I do, please contact me. So just meeting with all the supervisors, handing out my business cards. I put little clips on all of them and say, give these to all the guys to keep in their trucks. Usually the most common way to get a referral is the trooper will email me the case number and just send a little blurb of kind of what happened. And a lot of them are still like, I don't know if this is what, anything you can work with. And I just tell them, send me everything. If it is something I can work with, I will. If it's not, then, we'll figure it out. So I get a lot of emails, text messages, phone calls. Sometimes they'll call. If they're a day shift, my office is in the Gray Barracks, which is Troop B. So sometimes if troopers need to go into the barracks for anything and they see that I'm here, I've had really good conversations with a lot of the road guys just sitting in my office. So that's usually how I get them. We have a CAD system, which is like a computerized dispatch. So every morning, I just review calls that came in overnight. If it's a Monday, I review calls that came in over the weekend. I look at every call. Sometimes it's like a 911 hang up. That can be something that might be something I can work with. Disorderly conduct. Sometimes there are traffic stops in which there's elements of some substance use disorder or something like that. So I tend to check every call. There's a lot of them. So if I see a call like that, I'll reach out to the trooper, usually by email, or if I have their number, I'll call them. And if they're not a night shifter, I will not call somebody during the day if they work nights. And just touch base with them and say, hey, is this something you want me to follow up with? Or just give them my thoughts and say, this is what I'm going to do. So, yeah, typical response, a lot of phone calls, just learning community resources in this area. When I did child protective work, it was in the Lewiston area. So I covered Androscoggin, Oxford, and Franklin. So I was very familiar with services up that way. So just learning like the York County area, Cumberland County, knowing all the different organizations for domestic violence or substance use, or the shelters, soup kitchens, all that kind of stuff has been really helpful. And just kind of maintaining the relationship with other law enforcement agencies that also handle these, that's been helpful as well. Just contacting their liaisons and say, hey, I have a guy in this area, what do you know about? And just that communication has been really big. So reaching out to people. Right now, we don't co-respond, so we don't go to people's homes or meet with them. So it's basically phone calls. Sometimes it's email if that's what they prefer. So oftentimes if we have a case, we'll call, leave a voicemail, don't get a call back. I usually call once a week for 2 weeks. And if I don't get a call back, then I just let it go. So.
Thanks, Elsa. I appreciate that. And we are in our infancy as it relates to how this whole thing best works, right? So I hope some of you who find yourselves in our catchment area and would like to partner with us to please reach out to whoever that is. At least for us, I won't speak for Joe, but certainly for us, the wider we can cast that net and partner, I think the more effective we will all be. But Joe talked about it, and we just heard a little bit from Elsie, but there are different types of responses. And Joe, I wonder if you could just explain what those look like. And I'm happy to chime in at the end as far as what we're doing at this point.
Yeah, I feel like we all kind of do it a little bit differently, and that's okay. I feel like that's actually what makes it work. Being able to have a variety of options is always my favorite. But getting a program started usually is in that place of a lot of phone calls and building those connections, the stakeholder engagement, right? Like, so building that relationship between hospitals, emergency rooms, who's in your area for those services, that actually takes time. And it's good to do that in regardless of where you're going to go on that path. But the co-response model that I do is, like I said, I bring my own car just because I can respond to a situation with officers and then together de-escalating and determining it's safe and it's not a police issue. I can stay longer and I might be connecting somebody to services or may even be transporting to the hospital. And then the other end of the spectrum would be the alternative response, which would be going without officers. I personally like being able to do any of those things depending on the situation, because I've been doing this for 17 years and no matter what training and all the experience that I've had, I know that there could be a call today that is different than anything else. So I like being able to have the option to be able to do it different ways. You can have like With the co-response model, you're able to then have maybe an officer available, but not necessarily needing to respond with you. And that can just add another element of safety. So I think that the different models work and create a benefit regardless of how they are. And as we build them and expand them to being able to have as many options as possible to be able to use in any situation is the best. I do want to say the options model. So the options program, everybody who's a part of this, you have a substance use liaison with every county. So that state of Maine options program is great. They at least could be a point of contact for anyone here. And they're also, some are co-responding depending on their relationship with their law enforcement agencies, but they're still getting referrals where they may be doing follow-ups. I can't say enough about the follow-up piece for law enforcement, right? So even if I'm not going to a call with an officer, so even in my own department, because I do co-response, I'm not on at 2 a.m. So an officer from that shift may be emailing me and just having me do follow-up. And that way I can try to help see what I can do and what things I can put in place for that person or that family, and proactively trying to alleviate some of those calls to police. Because in everybody's profession, when they don't know what to do in everybody's lives, they call 911. And I just like to see any of this collaborative law enforcement and social work and mental health being, we can be their backup, right? So they can go, like the lieutenant said, and put out the fire for that day. And then we can try to help see what we can put in place so that those fires kind of don't keep coming up.
Joe, thank you. I appreciate that. And it really is a nice segue. And I, on the side here, I just sent a message saying, hey, you're going to hang out for this block. And Jacinta, sorry to put you on the spot and you can deny my request, but did I understand it correctly that you worked with a behavioral health professional either attached to a law enforcement agency or to some degree? I'll pause there and you can correct me or confirm that I understood it correctly.
So I worked with a behavioral health professional and law enforcement like separately, but to handle an unsafe situation, it was everyone was involved, but it was a police officer, just a local one. Does that answer that?
It does. And can you tell me, did they work collaboratively to help work through your particular situation that you described to all of us?
Yeah. No, what ended up kind of being useful in that situation was I reached out to the police officer more in a proactive manner before waiting for something to happen. Like I said, there was a weapon on property that the adolescent was refusing to disclose where it was, and the parents felt unsafe. And the behavioral health professional worker that was with the child was aware that there was, a hatchet and didn't, and was open to processing and in which ways that he could to see if he would give it to him. But before we knew if he was willing to give it up or not, I called the local police department to explain what was happening and what would their intervention look like if he weren't to give up the weapon. And they were very transparent, and they did know the kid very well, so they were able to give pointers and say that he hates seeing us, he won't be happy to see us, and this is something that's worked in the past if you approach it like this. And then I touched back with the BHP who was with the kid at the time, and was able to kind of lay out using the BHP's kind of language tools that I might not have to guide the conversation and explain options to the child, and he ended up giving the weapon to his worker, And I was able to touch back with the police department, who said they would be kind of like on standby if the situation were to escalate, to come and have a conversation with the kiddo.
Okay, great. No, I appreciate that, because part of our role that we need to understand, specific to me, I take pride in this uniform that I wear. A lot comes behind it, but I also understand that somebody in crisis or some other situation, they don't appreciate that. That is a deterrent for them. And maybe I'll have Jenny just respond to that as we've kind of prepped a question for that on what that really looks like in the community, and maybe some of that intuitive understanding as social workers that you all have, that police sometimes aren't super at understanding. Is that enough to tee you up, Jenny, for that one?
Well, it's in my answer, but are you going to ask the whole question?
Why don't you go ahead with that, and we'll see where it goes, as far as kind of teeing up that, there are some calls that don't fit in a criminal role, but we don't know what we have until we get there. But if we have somebody who's a mental health professional and takes cues or has a relationship with these folks already, we may want to know that and rely on their expertise.
Yes, which is why the hope is to eventually do the co-responding, because there is times where, like I previously said, we assess things differently, and at times the uniform itself could be a trigger for someone. So just having somebody to talk to that is not in uniform, that is in plain clothing, and it's beneficial to the person. It's just really different than that. And then there's times the other co-respondent is the alternative response, like Joe had said, when it's totally mental health, very low risk, that it's just either one or two social workers going out, that there's no law enforcement. And so there's no need to even one, take their time, or to have the person be subjected to that. But to put it in perspective, there's the way that calls are closed out. In 2022, the Maine State Police had 228 mental health calls. That number is truly, really underrated how it's captured, because that's just how it's closed out. There's many times that there are mental health related in a lot of calls, but it's closed out under another category. And those calls keep coming up. And with those calls, though, they're often, many times, because we do the NAMI referrals, we have to put if they're repeat calls. And most of the time they are repeat calls. It's the same with welfare calls. We had 1,424 in 2022. So far this year, since the beginning of May, we've already had 453. And a lot of times, again, they're the same. And a lot of those calls, I don't want to say a percentage because I did not do the report on that, but a huge percentage of those have absolutely nothing to do with law enforcement. So there's really a huge need for the social work piece of it versus the law enforcement. It's two totally separate, and there are times where just us are appropriate and law enforcement is not. I have no idea if I answered your question.
You did. What I'm going to.
I was not prepared for that one.
That's okay. But what you've really alluded to is sometimes when that person is in need, if they're in crisis, a response or a referral needs to happen as soon as possible to break that cycle. And from our perspective, we finally have people in place, as opposed to picking up the phone and trying to figure out what's the best resource for this particular set of circumstances. And for us to be able to make that in the moment call reasonably, right? Like Joe said, at 2 a.m, I'm probably not going to wake Jenny up, at least in the central field trip. but we can make those real-time referrals to get help started now. Whereas if you call somebody and try to explain the situation, that may take valuable time that the trooper or police officer or deputy just doesn't have time to do. But I tell you, who knows how to fit that perfectly would be these ladies who are embedded with us, know us on a first name basis, are able to share information in real time to get that ball rolling. And as Jenny said, the need continues to come. But at the same time, we have seen success stories in this model within the first 3 months of us getting started. So I'm as equally encouraged as we've heard things like the RISE program to see fruits of what we've started move to the future. And hopefully all of you will be part of that with us to really help these folks in need to get them back on that level where they're really performing in whatever role it is that they're taking. So I wanted to pause here for just a minute. I know there's been some questions that are popping up in the chat. Chris is, I don't have my chat up at the moment, but are there any specific questions?
One question that was answered directly, but the one question that's still out there is, do you guys find that there are enough community providers to meet with the needs of everyone you work with? That's probably true for all of us, right? Probably not, but.
And I'll pause, and whoever wants to answer that to go ahead and do that.
I think the answer for all of us is no. I mean, there's wait list for everything. Every once in a while you get lucky. I got lucky with someone that'd been trying to find a counselor forever. I called on a Thursday and happened to get them an appointment the following Tuesday. I have no idea how I did that.
Yeah, I will say, I was actually just talking with someone today. It took us, we had a unhoused veteran who had some medical needs, and we were able to get a bed like 2 days out, right? Like, because there's a list. But it was going to mean like a bus ticket, a hotel room in between, like he couldn't be sleeping outside. Like, it's just trying to piece all those things together. I mean, we're collaborating all the time with emergency room staff where they can't hospitalize somebody because there isn't a bed. They can only hold them in emergency rooms for so long. Our substance use access to treatment, we need long-term integrated mental health, substance use, and trauma care. We have some wonderful models. We have wonderful people working in all of these areas in our communities across the state, and there just isn't enough. And there just isn't enough. We need more of them. We can fill beds faster than they can come up. And so, and without having all of those things in place, we're not actually helping somebody. So when it comes to the long-term effects of having mental health, substance use, trauma, and being unhoused, you put that over time with them intersecting with any of those systems, but not actually getting a sustainable recovery for them across the board. It's almost like setting them up for failure. And then that every time like takes away some of that hope. And at the same time, that's going to escalate them further each time when they intercept with law enforcement. So when somebody was repeatedly tried and been willing to access the system, but not get what they need, that's going to make it harder to de-escalate them in that next instance when they are intersecting with law enforcement. So it's a safety issue across the board for that person, for officer safety, for community safety, because we're not giving them the effective treatment when they need it in a sustainable way.
There was a comment, it'll be great to see when the data comes out. I'm sure there'll be significant reduction in repeat calls with the individuals the behavioral health specialists are working with. So I'm sure you're tracking that data. And then the next question, in regards to this model being fairly new, is there anything social service agencies, social workers can do to encourage local and county law enforcement to have embedded social workers? I can easily think of a few clients who would benefit from a social work-based response rather than full police response.
So there's actually there is a pathway. So if you would like this position in a community that you serve in, first approaching your city council. Now, this has become a best practice across the nation. And so there's information out there, Council of State Government, Bureau of Justice Assistance, and Department of Justice, and looking up law enforcement and mental health learning sites. And the one in Maine is in Portland. And I have been a part of that process, and I'm happy to help other places build that program. But it really starts with going to your city council in your area, and you can even partner different communities together. So if, for example, Windham and Gorham were able to partner for a position. Once that position is in place, they're going to prove the benefit, and they're going to be able to expand that, right? So yeah, we'll start with your city council. You can pressure them that this is best practice. It works best for the mental health system and for law enforcement. It's a win-win situation for everybody. We all benefit from it.
Can I just add something to that too? With the state police, we cover a huge area, so we often call, it's not call sharing, but we'll answer calls in counties. So one thing that I did and asked my lieutenant to do was meet with all the county sheriffs in the counties that I cover. Just let them know who I was, what I do. We have a lot of the same interactions with people. Sometimes it's 1 week, it'll be the county sheriff that responds. The next week it'll be Maine State Police. So I just wanted to get my name out there and say, hey, if you have interactions, here's my email, just let us know, kind of give us a heads up if something continues. Also meeting with the intensive case managers in the jails has been super helpful as well. So having them know who I am, you know, me knowing them, all that kind of stuff. That's been really helpful. And I think kind of when I suggested this at first, it was a little like, no, because we don't want the county to put their work on you, like start giving you cases with their, you know, people that they're interacting with, and that hasn't happened. So, and I know how to say no, and I know some of the sheriffs very well, and they know I can say no. So that hasn't been an issue, but just that collaboration and just knowing people and who you can go to, and just and I even told them, if you have a question, just give me a call and we can figure something out. So.
Thank you all for responding to those questions. Again, for us, this program, it is in its infancy, but watching how these ladies interact with the law enforcement officers and looking at the specific types of calls they're responding to, the benefit is incredible. It's to the point where, what do we do without this? And I think we're just going to see that increase over time, but we'll get to a point where it's, you know, we meet we're at capacity, like I said before, but the hard charging attitude that I'm seeing from R2 is fantastic. We're actually R3 now. We're going to have a total of 5, but the more we can provide these services to the folks in the community, I think the better off we're all going to be. As we come down to the end of the hour, I just want to go around and give each of these behavioral professionals just an opportunity to share a short success story on maybe they have experience so far. We all have challenges, but I think it's important to know that from those challenges, we are seeing success stories. Elsie, I think I'll take this in the same order we started, but do you want me to pass, or do you have one off the top of your head that you'd like to share?
I do. It's a state police had been called for a woman that was sleeping in her car. Her friends were concerned they couldn't find her. She did have a history of substance use. Her friends drove around, ended up finding her. She was asleep in her car. They thought she was either passed out or dead from an overdose. So they called the police. The state police responded. They were, pounding on the windows and yelling, and they eventually had to break her car window and to get to her to make sure she was safe. She ended up waking up. She was very upset. She's like, I'm just sleeping. I'm homeless. I have no house, no job. Leave me alone. So I called her, and her phone had been off. She called me back 2 weeks later, I think. Her phone had been shut off. But when I reached out to her, the state police were actually able to get the window in her car replaced. She actually drove a Ford Explorer, which is the same make and model as most of the cruisers the troopers drive. So they were able to switch out the window in our motor pool in Augusta. At that point, her main job was doing DoorDash and delivery services, which she couldn't do with a broken window in her vehicle. So she was able to just get that going right back again. She didn't have to pay anything. And she ended up calling me a couple weeks later and said that she had re-entered a treatment program, although she had been in recovery for over a year. But she took that upon herself to get that done. And she actually wrote a really nice card for the trooper that broke her window. And she's like, tell him I'm so sorry, I was mad. So it was kind of beneficial all around, but just learning, I've never had to deal with that. Like, oh, okay, how do I fix a window? It's just, is that an insurance thing or is it, but the deductible was too low or too high or whatever it was. So I'm just really glad we were able to help her out and she's doing well now. So.
Thanks, Elsie. Joe, on to you.
So it's too hard for me to pick one specific story, but I'm gonna tell you a theme that as I'm really passionate about is people who would otherwise be evicted. So I work a lot with property managers in my area. Don't let me know the day of somebody's being evicted. Let me know like at the first lease violation. And let me see what I can put in place and try to keep somebody's housing. So with the unhoused pressure that we have of those who are already unhoused in our communities, I really am passionate about keeping people's housing. So when I'm able to work with somebody and get them to keep their housing and having that be successful, especially somebody who's advanced in age and they're looking at that transition of going into assisted living, it's not quite there for APS, I can help bridge that gap with putting some things in place and then helping with that process of accepting assisted living. So it's more on their terms. So when I'm able to literally hold someone's hand through that process so that they don't end up unhoused, but they're able to do a smoother transition, especially with our veteran population or our elderly population, that is super passionate place for me. And it's a gap in our system. And I know that I work closely with Southern Maine Agency on Aging or with people in other agencies trying to do that overlap and keeping people safe during a very difficult time where they're very vulnerable.
Great, Joe. Thanks. I appreciate that. Jenny, over to you.
So I have a couple. There was one that I actually worked with APS. The guy had been calling between us and KSO, Kennebec Sheriff's Department, had called 47 times. None of it was ever law enforcement. He was calling because he wanted to be transported either from his recliner to his bed or vice versa, and never wanted to be transferred to the hospital. The last time that we actually dealt with him, I did go to the home, and I actually followed him from the home to the hospital and spoke with the doctor there, and then spoke with APS. And they had only closed because they thought he was being placed in a home. And they were very surprised that he hadn't been placed in a home. And then I spoke with his next of kin, and long story short, he had a whole bunch of things that he didn't have a choice at this time. He really was, and the APS worker was great. They did call me. He was really being placed this time because it was determined that he was too unsafe. He had too many medical problems this time. Last time it was determined that he did have the capacity to say that he couldn't, even though he had told them that he would go. He changed his mind at the last time. Another one was a single mom of 5 kids had called. She has a 14-year-old that very, very big for his age, not going to school, ripping the doors off the frame. Dad agreed to take him, who lives in Southern Maine, but he would not get in the car to go to Dad. So not really anything that law enforcement can do. So her biggest thing was, I need him to go to school. I need you to make him go to school. I don't really know how to do that. So he had services in the past. She was willing to do that. He'd been receptive to services in the past. So I called MST. They could get him in within 3 to 4 weeks. And then I found an agency for case management that did not have a wait list. So they got him in, and she hasn't had to call, and she hasn't contacted me for quite a few weeks. So I'm hoping no news means good news.
Jenny, thank you. And thank you to all three. So as we wrap up, this is coming from a guy who's been doing this job for 24 years, whose fuse gets a little shorter every day on certain things. But my story is this: I was on my way home from a long day and came upon a vehicle that was all over the road. And at 4 o'clock in the afternoon, it can only mean a few things, and none of them are very good. But it was a warden that was in front of me that actually saw the same thing. And we both stopped the vehicle at the same time and approached a senior who was behind the wheel with huge glasses and a hat pulled way down over her face, and realized that, okay, none of what I had thought was going to happen here was actually taking place. She was on her way back from cancer treatment and felt like she probably had 3 or 4% energy left in her body for energy, and was just trying to get home because the ride that she had depended on was unavailable that afternoon, and she didn't want to inconvenience anybody. So after a brief roadside conversation, she agreed that I could be her chauffeur for the last 2 miles. So she slid over in her passenger seat. I left my car on the side of the road and drove her home the rest of the way. And she was entirely grateful for that assistance that day. So as we drove that 2 or 3 miles, I learned that she has been battling cancer for almost 2 handfuls of years, was a fighter, was pretty funny, but she was just exhausted and didn't want to ask her neighbor for help. So I got her dropped off, left her my business card, and I immediately thought of Jenny. What can we do so that she will never have to put herself and others in danger if she falls asleep at the wheel traveling that 20 miles between Augusta and mid-Lincoln County? So Jenny reached out to her. She did a little bit of her Rolodex work and realized that the hospital that she's receiving her treatment does offer these services of transportation. Pat Hood, 24 years with the state police, had no idea that's out there. So we made a follow-up appointment with her. Jenny and I went over there. We brought her a gift card and some flowers, and we sat in her living room for an hour, and it recharged me to a level that I couldn't believe. It was fantastic to be a representative of law enforcement that she probably has never had contact with other than being stopped, and to have a conversation with an hour about family, her plans, her past husband, or her husband who had passed. She lives alone. Was incredibly, incredibly rewarding, all based on a simple traffic stop, and then having these different opportunities to provide her services, let her know that we care, and to set her up for success in the future. So after that hour, I had to break it off because I'm like, we could be here all day. We've got to go. But the next time that we've set the stage, next time we're going to visit, I'm going to sit down and go through her free credit report through the Federal Trade Commission, because her son thinks that she could be a target of home title theft. So not that looking at a credit file is a great way to start, but it could show her that we have more to offer in this relationship with law enforcement, behavioral health specialist, and her together to set her up for success for her next, how many years she's going to fight cancer. So I thought that was a really, truly fitting end to our really program that's in infancy, but it really, really highlighted what a good thing this is, not only for us, but all across Maine. And again, Joe, thank you for being a representative for the other agencies. I think this is just going to grow. But to at least spend an hour together explaining this neat program, I hope there's a role for all of you advocates out there that can say, I'd like to join your group. Can you help me with this specific case? Because sometimes I realize that not everyone loves this uniform as much as I do, but if you could send a Jenny, a Joe, and Elsie to a place to interact with someone who's you're trying to support, and we can provide that, I think that's great for everybody. So we've made it to our next time hack. Thank you, everybody, for the questions that you submitted. Feel free to reach out to me if you need to reach any of our behavioral health specialists. But for now, I want to move on to our next block, and that is going to be with Jay Martin, who's the Executive Director of Legal Services for the Elderly. I didn't see her pop on, but I've got a lot of screens open. Jay, are you there now?
I'm here, Pat. I'm here.
All right. Jay is going to give us an update on the Elder Justice Roadmap and what that looks like. Probably a lot of you have heard of that program, but I'll leave it to Jay to give a little bit of a history and where we head over the next couple of years. Jay, it's all yours.
Thanks so much. And I have some slides to share. I think somebody's going to help with. But again, I'm Jay Martin, Executive Director at LSE. And I'm really excited to be here with you today. I'm still feeling the feelings of being so moved by the stories that we just heard about the work that's being done in that new program. So I'm going to spend just a brief period with all of you talking about the roadmap. But I know you guys have been hard at the summit. You're in the second half day and near the end of that day. So let's all take a stretch. Everybody take a minute. I'm going to give you 1 minute of my time. Just take a minute, something that makes you feel a little more comfortable, a little less hunched over your desk there. Just take a minute for that. And then we'll move into the conversation about the roadmap. Just 1 minute on legal services for the elderly. It's my hope that most of you are familiar with us, but just in case, I want to say we're a statewide legal services provider organization. We focus on helping people 60 and older that face problems that involve their basic human needs and keep them from meeting their basic needs, getting shelter or food or being safe in their homes, those kinds of things. LSE also provides very extensive Medicare advocacy services, helping people understand that benefit. We help in excess of 3,500 people a year with legal problems. Over 300 of those are individuals that are victims of elder abuse. And one thing that many of professionals in Maine don't realize is most states don't have a legal services for the elderly type entity. As I've done work on the national stage in the elder abuse area for many, many other states, the top thing on their list of unmet needs is access to an attorney to help with the civil side of legal issues for victims, because in many, many states, there's no path to assistance or a dedicated entity like there is like LSE is. And then before I move into the substance, I want to give a shout out. I had the privilege of co-chairing the Elder Justice Coordinating Partnership that formed the roadmap, but I did that work with Judith Shaw. I have no idea if Judy is on in the program or in the audience here today, but she's with the Office of Securities. For those of you that have ever gotten to work with Judy, you know that she is an amazing professional. Nobody can run a meeting like Judy. Thank goodness she was co-chair of the partnership. And without her leadership, the roadmap wouldn't exist. And in addition, the Office of Securities really established or provided a lot of in-kind support for the work for the partnership. So just a shout out to Judy and that office. So next slide, please. So what I'm going to talk about today, the time I have with you, is just a little bit of history behind the formation, because it's helpful, because it helps all of you understand just the history of the work in the elder justice area in Maine. Why the roadmap is structured the way it is, we'll talk about that. And then we'll move to talking about what some of the recommendations were in the roadmap and a little bit of a flavor about which ones of those are moving forward and which ones are still a work in progress. And then we'll close with some suggestions I have for what you can do in terms of next steps around the Maine's Elder Justice Roadmap. So next slide, please. So first, a little history about how this came about. In 2014, the Federal Department of Justice published an Elder Justice Roadmap. It was really intended to be an inspirational document for states around the country to consider doing coalition-based work to identify how that particular state could improve their response to elder abuse, because it was acknowledged that there can't be a one-size-fits-all, that each state had strengths and weaknesses, different gaps and different barriers. And so the federal document was, as I say, an inspirational document, a jumping off point. And then in 2019, we were able at LSE to get grant support from the John T. Gorman Foundation for the establishment of a roadmap in Maine. It would be modeled after that inspirational document, but also really be customized to fit here in Maine and make the most of things, that the strengths we have here. The grant funding was used to support consultants to help with the work, in particular, the Cutler Institute at the Muskie School of Public Policy, which kept minutes of the meetings, drafted the report, did a lot of behind the lines scene surveying and that kind of thing. So once we knew we had the grant support we needed, victim service providers got in a room together, and because we knew we were all going to have to commit our resources to this work if it was going to happen. So LSE, MCASA, the Coalition in Domestic Violence, Elder Abuse Institute of Maine, Long-Term Care Ombudsman, we sat in a room together, the directors, and said, are we really willing to commit our resources to this? And it was one meeting and a quick yes. And with that understanding in place, we were able to reach out to the governor and say, we're in if you will make this happen. If we can get an executive order issued and form the partnership, we're ready to roll up our sleeves and do this work. And I want to just read a couple things from that executive order, because I think all of us that care very passionately about issues around elder abuse sometimes need to reground ourselves in why the problem is so serious and why we're putting so much time and energy into it. So just a bit from that executive order, stating, whereas the United States Department of Justice estimates 1 in 9 people over the age of 60 will be abused or exploited every year, for an estimated 33,000 victims of elder abuse in Maine alone. That number's 40,000, that estimate's 40,000 today. Where most elder abuse is perpetrated by someone in a position that involves an expectation of trust, and most financial exploitation is perpetrated by family members. Where older adults who are abused or mistreated are 3 times more likely to die within the next decade after the abuse than adults in the same age group not subject to abuse. And whereas a recent study of financial exploitation in Maine found that between 10.5 million and 64 million in savings and assets are lost by Maine seniors every year to financial exploitation. And it gives you a flavor. These are the bases that the governor identified for why it was so important that the Elder Justice Partnership was formed. And I am very proud of Maine for leading in this area. This is not an action that most states, again, in the nation have taken, and it's partly because it's such an investment in both public and private resources to do this kind of work. So next slide, please. So another thing that was very notable about this action and the work is that unlike coalitions in many other parts of the country, and unlike that federal initiative, Maine decided that both the public and private sectors really needed to be at the table for this particular exercise. We needed both perspectives. To be honest, it keeps one sector from not pointing to the other and saying, if they just do their part, this work would go better. We had everybody at the table so that we had all those voices come in and be brought to bear. You can take a look at the members at this particular link, but it included law enforcement, prosecutors, many offices from the Department of Health and Human Services, the Attorney General, and the U.S. Attorney's Office. So again, we really had the right people at the table to try to figure out what we could do in a concrete way that might move the work forward. I'll make a brief note to say that the executive order was issued in October of 2019. The work was due to launch in 2020. We all know what happened in 2020. So the entire work of the partnership was conducted via Zoom and remote means. And despite that challenge, we held 9 meetings. The meetings were 3.5 hours in length. There was a lot of homework in between, and the roadmap was issued right on schedule in December of 21. So next slide, please. So the EO was specific with the charge to the partnership, and that was that we were to work together to identify the challenges to prevention and detection and response to elder abuse, and then to develop priorities that would improve the response. And based again on that federal inspirational document, the governor gave us guidance to identify priorities in 4 areas: direct victim services, public and professional education, public policy, and data collection and evaluation. Next slide, please. And as often is the case with coalition efforts, collaborative efforts, it was very important that everybody at the table doing this work and this time-consuming work that was in addition to their day jobs, so to speak, was clear about why we cared about doing that work and what we were trying to accomplish. So we held out through it all these 3 desired results. We want to decrease the incidence of elder abuse in Maine. And we all know how hard that is to measure. Prevention efforts are nearly impossible to measure in this world today where everybody talks about data. If you keep somebody from experiencing abuse that might otherwise, where does that get counted? How does that get counted? But we knew that still prevention was really one of the things we wanted to focus on. We also want to increase the number of people seeking and receiving help, because we all know how underreported the incidence of elder abuse is, and how many people go without help that need it. And then third, and I think this is some of the work that most energized the partnership, we really wanted to improve the response across disciplines to elder abuse. Again, we wanted everybody to work together, much like the inspiring previous presentation, talking about 2 very different disciplines working together and how much of a better result that they got us because of using that kind of a response. So next slide, please. So the roadmap took those 4 areas of focus and developed recommendations in each area. And then the recommendations were also grouped by the partnership into top priority recommendations, what we called secondary, but essentially just the next tier of priority recommendations. And then given the short time we had to do the work, there were some areas of where the recommendations just couldn't be fleshed out, and they were set aside for further, what we called further study. And so today, what I want to give you some examples of and some flavor of are the top priority recommendations in the 4 areas of focus, and where I can give you a flavor of whether those recommendations are moving forward or not. And again, this is just an overview, a sampling of the full extent of what was in the roadmap. So starting with direct victim services, just as a notion of the kind of recommendations that came forward in the top category. One was to examine the staffing capacity at Adult Protective Services. Now, I'm not speaking for Adult Protective Services, but as someone outside the system, I think many of us thought that probably more capacity would be a very positive thing. And that is a conclusion that was reached, and there is legislation and a budget initiative pending right now that would focus on increased capacity in adult protective services. So again, a recommendation that's moving forward as a result of efforts at the Department of Health and Human Services. There was also a recommendation to increase and provide wraparound support services, including case management for victims that were receiving adult protective services support. You've heard a lot about this fine work in the summit already. You've heard about the RISE program, and I think have heard quite a bit about the really amazing case management work being done by the Elder Abuse Institute of Maine. But again, this was a recommendation that came out of the partnership, appeared in the roadmap, and that DHHS proceeded on in their elder justice package in the budget. Another direct victim services recommendation was to establish dedicated statewide forensic auditing resources to support law enforcement in investigating financial exploitation. And I know the AG's office is very interested in pursuing this initiative. I do not have up-to-date information about whether they were successful in securing funding for this in the current budget, but I know this is something they're very interested in making available on a statewide basis. Next slide, please. In the public and professional education area, just a sampling of recommendations. One was to add elder abuse investigator training to the offerings at the Maine Criminal Justice Academy. This is an idea that I've heard and repeatedly raised as a very solid idea that would make a difference for probably at least a decade. At this point, I think this is still not on the ground moving forward, but there continues to be agreement that it would be very helpful to have this added to the academy. It also, top priority in this area were expanding and enhancing training of APS staff and community partners, which APS has moved forward with, and also to legally mandate training for mandatory reporters. And again, that is in the legislature right now in process. Hopefully, and I may not even be up to date on this one, hopefully absolutely becoming a reality for us in Maine, that there'll be mandated training. Next slide, please. In the public policy area, recommendations included continuing to convene the partnership, which we have twice a year for monitoring purposes on an informal basis been convening. Adding an attorney fee provision to the Improvident Transfer of Title Act, which the partnership elected to defer activity on that until next year or after. And then also restructuring the Maine Elder Death Analysis Review Team, which again, I know the Attorney General's been looking at and trying to obtain staffing support so that that team could get re-energized. And next slide, please. And in the data collection and evaluation area, one item that I was very excited about and is, I think, not moving forward with speed yet, was creating a data collection vehicle within the criminal justice world so we could begin to have data on the number of older victims. That is a data set we don't really have right now in Maine because of the way the data is collected. And another top priority was an annual report coming out of APS, which again, I think you heard about earlier in the summit. I believe Aaron presented data from that hot off the press or soon hot off the press report to all of you. Next slide, please. I know that's kind of a whirlwind tour, and I fear I may not have left a lot of time for questions, but I'll do my best to answer them. What can you do? Become familiar with the roadmap. Take a look at it. If you see things in there that you think really matter, advocate for them, talk about them, talk to people that can make them happen. We're still really trying to make sure that the roadmap is a living, breathing document. And every one of you can be a help in making that happen. So if you haven't read it, read it. If you don't like long documents, read the snapshot. And I'll take questions if I have a couple minutes left, I think. So I'm happy to, if you want to bring the slides down, I'm happy to try and answer questions if there are any. I think I saw maybe one in the chat, but maybe there's more.
That was me asking if there were any questions.
Okay, very good. All right. I thought there was one earlier, but yep, maybe not. Great, good. I just, well, and then I'll just, again, I put my final plug in. All your voices do really matter. So if you see something in the roadmap that excites you, then reach out. And the membership is listed in the a link as well. When people hear that something matters to all of us in the field that are doing this work every day and seeing the impacts on victims, I think it really can make a difference. So weigh in where you see things that you think would make a difference in your world. And thanks for all the good work all of you do.
Jay, thank you very much for sharing the work on that. And as you said, the fact that that was born through COVID is just another example of the horsepower amongst all the members. So thank you to all, whether you're all here that took part in that. Because again, as we get busy, it provides that guidance. So Jay, appreciate your time giving us an update on that. As we draw to a close today, I wanted to take a few minutes and highlight the World Elder Abuse Awareness Day campaign that we at the Maine Council for Elder Abuse Prevention have worked on behind the scenes to have new content and material for this year. As we go through this, I'm going to have Ellen, our tech wizard behind the scene, if she's able to actually guide us through going to our webpage and locating the documents that we're going to talk about, how to find them and use them to how your agency feels appropriate as we work our way up to June 15th. So quickly, World Elder Abuse Awareness Day is just that. It's not local. This is a world day that we all focus or have agreed that we're going to focus on this campaign. The more that we talk about it, the more it becomes a social norm to have these conversations and be able to at least express the concern or what it is, the advocacy that you have for elders or seniors in your world, in your lives. But for the council, the goal here is that anyone affiliated with MESA, you're welcome to share the goals that we have put aside for this day. We've created these three different graphics that we would like to, I think one more, a bit more down, there you go. Jill, if you might be able to, oh, there we go, she found it. So here are the three graphics that we feel free to use them in any way that you feel appropriate for your agency. It's graphics that we're asking that approximately for the week before June 15th, tag one of those graphics, put your message on it, share your hashtag on any of the platforms, whether it's Facebook, Instagram, Twitter, whatever you use, feel free to grab these, put your own saying below it, just so it sparks communication within your social circles. And then on the day, June 15th, grab another one, put a different comment or some type of hashtag on that for your social circle. And then the week after, use that third slide again to highlight the importance of us as a community to discuss this topic. I think of it as something that has become more socially acceptable to talk about. It's an education piece, at least in my mind, that you're able to talk about scams that people may have gone through, situations you've heard people living in, maybe through this educational piece to say, what can we do in our community to combat that, to make sure that we don't have another person who has experienced that type of loss, that type of fear. Many of the things that we heard from our partners when we heard what the good work of the RISE program is going through. But another piece is, who are those partners? And maybe we can reach out to people that are looking for help that just don't know where to get it. So that's our goal, to use some of these slides to make it easier for you to do on those days. And it looks like there's a request to drop a link in there. Ellen, I'm going to guess that that's something that we can do, although look at that. There it is. So that's the link to the World Abuse Awareness Day, where you can capture all of those items. And feel free to reach out to Jill or I. We can certainly help you with that as we get closer. But again, just another platform that we can, again, share our message collaboratively in our social circles, because as you've all heard, We do overlap in great ways, and I think that provides somewhat of a safety net. And this educational piece that we're going to put out for World Elder Abuse Awareness Day is just one of those tools that we have to continue to deliver that message. I'm going to pause for just a second and see if there's anyone else that has any questions about this before I go into some closing comments. All right, hearing none. So we made it the end of day 2. I'm sorry I missed Tuesday's content, but what we've heard today, I want to thank all the presenters. If you think about what's happening in Maine, that there's duplication on the national field, I think we should all be very proud to support such a good idea and do our part to make it better so they can come in and say, what is Maine doing now that we can take to our communities? That's a big deal. Thank you all for the work that you do in that field to support that mission. I want to extend another thank you to the Maine Credit Union League for technical support. Ellen's been behind the scenes. She also works with Rob, but they've done it for several years, and this would not be possible without them. So thank you very much to the Maine Credit Union League for extending that level of expertise to our little presentation today. Special thanks to Jill Randall, who chairs our Education and Awareness Committee, who guides us through this process. We are going to start in the next couple of weeks thinking about 2024. What can we bring you that's important in your world so that you can take and deploy out to your social network? I understand time is a precious commodity. We hope that the time that you've spent with us today is well worth the investment. We think it is, and we look forward to our next event, which is going to be the roundtable. We do anticipate that being in person. That's scheduled in Augusta on November 2nd. More information will come out. But for those of you who have not attended, it's a smaller event. We'll be in person to network so that we can reach out to community partners, best practices, see how we can help with specific challenges in your world. We'll be sending out a survey to the email that you registered to, and also accompanying that will be a certificate of attendance to use as you see fit to receive credit, educational credit, whatever fits in your profession. On that survey, please be as descriptive as you can, things that you liked, things you disliked, potential topics for next summits. We truly dissect that to the granular level to make sure this is as good as it can be and worth your time next year. So please take time to do that when it comes to you. And the last thing I'll close with is we've talked about it at every time, the beginning of Tuesday, we talked about it today. All of you are the community resources to address elder abuse and elder abuse prevention. Thank you to each one of you for the role you fill with that charge. It's important work. Sometimes it's hard to prove positives in that. It's easy to measure the negatives or the challenges, but again, know that your work is being done well. We look forward to working with you as we go out. But again, thank you for the roles that you each do. Appreciate your time here today, and reach out to the council for any questions or supporting roles that we might be able to do in your particular world. So thanks, be safe. Appreciate your time today, and we'll see you all soon. Take care.
I think there are a lot of people that probably aren't sitting at their computers, so maybe we should just close this meeting and then log back on.
Or-
Yeah. Is that the best way to do it, Ellen?
Yeah.
Okay,
Let's just do that.
okay.